The governor's office is touting a decline in COVID-19 numbers and a rise in vaccinations in Georgia. A major focus now ahead of the holidays is booster shots for those who need them and can get them. Here's Tracy Amick-Peer with the very latest.
Thanks so much.
Dr. Kathleen Toomey expecting guidance over the next few weeks when it comes to Moderna and Johnson & Johnson booster shots. But for now, the focus is on who can get the Pfizer booster shot.
It's everything from healthcare workers to teachers to anyone who works in a healthcare facility, cafeteria workers, the individuals working at our poultry plants, the people who keep our state running, from grocery store clerks to first responders to mailmen.
That includes people with jobs putting them at high risk, people 65 and older, those living in long-term care centers, and people with serious underlying medical conditions. Questions on boosters coming as we come down off the latest surge. Toward the end of August and the beginning of September, we were seeing more than 6,000 new cases a day. Now that number is around 3,700 a day. But Dr. Toomey cautions to not let our guard down.
Our numbers of total vaccinated individuals are still too low, and most experts believe that our rates are not sufficient to combat any possible future surges that may come our way.
Also, while cases and hospitalization numbers are slowly going down, keep in mind the holidays are just weeks away.
The fact that COVID-19 is already misbehaving before we get into Thanksgiving, Christmas, and New Year's is worrisome.
Piedmont Dr. Saju Matthew says we are also entering flu season, and the last thing he wants to see is a so-called twindemic.
COVID-19 and flu happening at the same time. So absolutely urge everybody to get the flu shot.
Dr. Toomey also stressing that 2 doses of Pfizer is still considered fully vaccinated, and the booster is not mandatory. It's just recommended for those higher risk groups.